Welcome to Marianas Press. We're at the Commonwealth Healthcare Corporation where we're with the CNMI's newest surgeon, Dr. George Elias. Welcome to Saipan and thanks for joining us.
Yeah, thank you. It's good to be here.
And so you arrived in January. It's been a few weeks. Just introduce yourself to the community who might be meeting you for the first time.
Okay.
Yeah.
I'm George Elias. It's nice to meet everyone. I began my medical career in 2007. And I am dual board certified in trauma, critical care, as well as general surgery. It's a variety of fields ranging from vascular, oncology, bariatric, colorectal, which is my personal interest, actually. And recently, before I came to Saipan, I had been able to develop the robotics program at the previous hospital that I was at. So hopefully that's something that, eventually down the line we can grow here. But certainly with a whole range of experiences, I plan on bringing that here to help benefit the local population, as well as the tourists and the visitors that come our way.
Can you explain more about that robotics program? Was it robot
cool.
surgeons?
Yeah, it's pretty awesome. A lot of the training in the States now involves residents, being adept at performing robotic surgery. And what that involves is you don't even have to be at the patient's bedside anymore. You're literally at the console. It's very articulated. You have a lot more detail as far as like getting into the sparse spaces in the human body, and you're able to isolate the pathology that you need to get to, instead of harming the good tissue. So it definitely makes things go by a lot faster when it comes to performing surgery. Faster is obviously safer for the patient because they're less likely to be on a long period of time on anesthesia. And it's also easy going on the surgeon's back. Back in when I was training, we obviously didn't have the robotic field. It was still new at the time. But we would literally be standing for a couple hours, depending on the type of case that we had to deal with. But yeah, it's a really great asset to have.
And you grew up in the Bay Area, and you went to West Point. Tell us a little bit about that part of your history.
Oh yes,
Yeah.
So that was obviously my first career, medicine being my second. After graduating from the academy in 2002. I spent active duty service. Most of it was in Korea with the 2nd Infantry Division, and then I pulled some strategic job a little further back, doing military intelligence before doing what I'm doing now. Very exciting work, but a lot of the skills and experiences that I've gained from that have helped me relate to the patients a lot better, relate to the families better, and certainly that helps with their overall care. And
when you were based in Sacramento, you were at a trauma 2 level hospital.
Yes,
right?
It was a level 2 trauma center, Mercy San Juan Hospital up in Carmichael, just one of the satellites around Sacramento. Very busy trauma center, and we typically call it the Gun and Knife Club. That's where I got most of my trauma experience after the training was over, and it was very worthwhile. I still talk to my colleagues back there. Very excited to keep in touch with them. We share things a lot as far as what cases, how to do it better, that sort of thing.
So Sacramento and Saipan, 2 very different places. Tell us a little bit about your first few weeks here. What has the experience been like, and anything unique that you've seen so far?
Oh well, I would say it was a completely positive experience for me on island. It didn't take me that long to get over the jet lag. Coming from Maine, it was a pretty significant jet lag for the first, I would say, maybe 5 days. Mm-hmm. But once I was able to get over that, the best part I like personally is all the Asian food that I could get here that I could not get in the state of Maine. At least we had some seafood, the lobster, that was it. But I missed the Filipino food. Obviously, I'm Filipino, and Korean food, Japanese food. There's plenty of seafood that you can get over here that I can't get back in my own hometown in Maine. And the other aspect that I really truly appreciate here on Saipan is that sense of community. Truly love how people just support each other. You don't really see that in the mainland as much, and so it really stirs my own heart, seeing that, and it really motivates me to do a better job for everyone too. We're all here in it together. We all live on a small island, and it's good to be self-sustainable that way.
And any difference in terms of cases or patients, anything that's striking to you so far since coming to Saipan?
Oh, well, all the patients here are very appreciative of the work we do here at CHCC. And like I said, it's a great motivational factor for myself and for my colleagues that work here every day. We're very happy to have those types of patients. And like I said, it's one big community, one big family, and that's what we're here for, to help the people here, and at the same time, I know it's hard to be sick and all, but everybody deserves that respect, and the patients here, they provide that respect, and we obviously want to give them that respect too.
Yeah, in the press release about your hiring, you said that you treat every patient as if they're your own family.
Oh,
so
absolutely.
That's your approach to care.
Yeah, that's always been my approach to care since I started medicine. I have a story with my own grandma. Unfortunately, it didn't feel like she was having the care that I felt she needed, and we all feel that for our own family members, and that got me to understand, okay, well, if I wanted my grandma to be treated in that way, then I most certainly should treat, every patient and their family members the same way. And I think it helps. I haven't had one complaint yet on that, so.
All right, and so why Saipan? It's a large move. What about the island? Made you decide to stay here for a few years, hopefully, right?
Oh yes. Well, as long as you want to keep me. But before I met my wife, we love to travel to different places on vacation. We both love the beach, and you have the best beaches around, in my opinion. So it just seemed to make common sense in that regard. So we're here for the long haul, and I'm excited about it.
All right, that's all the questions I had. I'm sure we'll see you out there in the community. But anything else you want to add? Any shout out you want to give to anyone watching?
Oh, of course. Great. So, first of all, it is April now, so it's the National Cancer Control Month. This is an opportunity for us to just reach out to the community and say, all right, if you haven't had your colonoscopy, then I highly encourage you to go see your primary care doctor about setting one up. That's the best opportunity for you to see me, because I am one of the 4 surgeons here that do the colonoscopies at this hospital. And the second one is, it's also apparently National Stress Day, or Stress Month as well. One way for me to relieve, the stress that can occur, which, interesting enough, is a lot less than how it was when I was living in the mainland. I do Kyokushin karate, which I haven't known about in the mainland. That's another perk of being here on Saipan. Sensei, shout out to Sensei Danny Benes for setting up the first Kyokushin karate dojo here on this island, and actually making awards in Guam and placing in Japan when they got invited. So that's something I do to relieve stress. I would encourage people to probably, if not karate, then something else. But as far as the shout outs are concerned, shout out to John Austin, Shout out to Zane Fujihara, Malia Dowell, who are all competing in the Guam Kyokushin tournament this Saturday. And obviously, special shouts out to Coach Senpai Eric, and also to Sensei Danny for inviting me into their family. So thank you for that.
All right, Doc, thank you so much for your time, and looking forward to getting to know you more during your time on Saipan here.
Okay,
Thank you.
absolutely.